Hey y'all, it's 5 a.m. and I'm up doing an emergency massage on my leg. And I wouldn't normally have it this bright in the room, but if I don't, the camera won't be able to pick me up and it'll be blurry. So, in any case, my hip has been in pain right in here. And the reason is because my leg muscles have been tight. And the reason my leg muscles have been tight is because I have not been doing massage on them with oil. Okay? You can roll on them and it helps a lot. It's really good. In fact, I think that you need both. And I haven't been doing the massage with the oil on my legs, and it just doesn't work because the stripping that's caused by going like this, the stripping is required. And you have to have some moisture, some oil on there. Okay, so I'm going to show you what I'm doing this morning at 5 a.m. I'm like, oh, and it's New Year's morning. It's New Year's Day. Okay, so this perineal muscle here affects directly the IT band here. And so if this is tight, then your IT band is tight. If your IT band is tight, then your gluteal muscles are tight. If your gluteal muscles are tight, then it's going to affect the tendons connecting to your upper iliac crest. Here, your low back. So when your low back is sore, it's very likely, almost certainly, that all of these, not just this, not just this, not just this, the whole thing, which is known in the Anatomy Trains book as your outer line, the outer line of muscles. I don't remember exactly the name, what they call it. But there's a bunch of different lines of muscles throughout your body. It's like the bones, you know. This bone's connected to that bone, and that bone's connected to that bone. And so I'm going to release this perineal major and minor here. There's a little one right there. Perineal minor, and then there's the major. And these two are always tight. They really are always tight on people. And you'll be able to feel it. If you do this and you really dig in, you really dig that out. Oh, Lord. Okay. And there's also the Tibialis Anterior here, but I can feel that that's not that tight. What also I need is the back line. Okay, so the back muscles, the calf muscles here, the soleus down here, and your gastrocnemius muscle here. And they're kind of like if you were to look at them on an anatomy chart, you'd see that they're split like a left and right side. Each one of them has a left and right side. Okay, so what you do to massage those is you squeeze. And you'll be able, if you dig in like that, you'll really be able to feel if they are sore. Okay, so strip them, strip them, strip them, strip them. You've got to have some oil on there. And I'm telling you, I have learned from experience that if you don't do this regularly, especially if you're doing a lot of cleansing and healing, you'll feel it. Eventually tendons will get sore and you'll get what the doctors call tendonitis. They're not going to tell you, they're not going to teach you how to do this, and this is the real way to fix it. You know what they're going to do. Here you go, off to CVS. They want to fill you full of drugs. Don't ask me. Don't ask me. I guess they don't know. They don't know, or I don't know. They're in a habit. That's their habit, to teach people to just pop these and pop those. Or let's cut you open. We want to cut you open. We've got a procedure for that. It's 50 grand and it's geared towards bankrupting the American economy. Okay, so these hamstrings right here, put some oil on them and start going like this. And move the leg at the same time. I hope you can see that. Sometimes I worry that you can't see what I'm doing very good. Okay. Now, watch this. I'm going to lean back like this. Okay, get down there. I'm gonna lean back like this. Okay? And I'm gonna push on that. I'm gonna use this hand for leverage back here. And then I'm gonna push on my leg like that. And I'm gonna strip all of these muscles by really leaning hard into them. And I can feel it pop, 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 popping over muscles that are tight. Okay, let's do two. Let's see if I can use my stomach muscles now to lean forward. Nah, it's not as good. Sometimes you have to just experiment, and you may find something that better works for you. Now, if I want to get up in here, I have to lean back farther, and then push forward, and then lean into it forward. Okay, so now I'm going to work on these inner ones in here. This foot won't get out of the way very good. I'm going to kind of work on the belly right in here. I've got this wood roller here that might help for that. Yeah, that really gets into it. And all this is a piece of wood, okay? This has nothing on the outside of it. Whenever I need to get really radical, that's what I do. I use this hard piece of solid wood because I've learned that nothing gets in there better. Oh my God, there we go. Yeah, this cross fiber bopping on those is effective. Yeah. Okay, so now I'm going to release this IT band with this thing. And it's a crazy, aggressive roller. Oh, Jesus. There we go. Right there. You gotta find the place and then try and release the muscles as much as possible. And you just can't do this with the hands. This kind of pressure, you can't do it, and the IT band needs it. This is the massage area that massage therapists dread working on. You've got to use your forearm. And if you're an ashiatsu therapist, though, you can step on it, and that really is so much easier. The IT band. Most massage therapists are not ashi therapists, and so they're screwed. Okay, so I've got some knots in here too. Okay, so I've got some knots on I've always had, and they're right in here. They're right in there. And I am going to either dig them out with my fingers like this, or I'm going to use this wood roller. And I think I'm going to use the wood roller. I'm sorry that this particular product is just not available on my site yet. And you may have to improvise. Okay, so I like to put the other leg on top of the other one. This one I'll actually just do it like this, because I gotta have more control. Oh yeah. And the more you search around, the more you're gonna find it and be able to dig those knots out. And you may have to search around with your fingers first, like this. Put some oil on there, like that. And I'm using coconut oil for those of you that want to know. Okay. Okay, so you may have to search and find them with your fingertips first, but then you may discover that the fingertips are getting the shit out just as good. Yeah, I'm really getting some stuff done here. Now, I'm going to work on these quads. Okay. Panama, Panama. Sometimes a song will just pop into your head. Panama, bum, 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 Panama. I know, it's not massage music, huh? La da da, la di da da. No, this is massage music. So yeah, lean into those. Push them both ways. Like, get right into the belly of it and kind of work the belly of the muscles circularly. And don't worry about that bullshit that people say. Always massage towards the heart. Yeah, this is an emergency massage and we're trying to dig freaking muscles out. We're not giving a flying fuck when the perineal muscle is going like this and your best leverage is like this. It's pushing away, not trying to pull towards the heart. If you can get leverage on this muscle and dig it out, you do that any way that you can. And you don't sweat which way it's going. So, dig these out too. This is easier to go any way, either way, down or back. And this is really such as, like, for me, the whole thing right here is just all tight and needs to be stripped out for a good period of time. And I can feel it right there. See how that's popping over the top of something? It's because it's like knotted right there. Okay, so that right there just needs bopping for a few minutes. That's where the word bop came from. Remember, like in the 50s it was bebop? Like bebop music? Bop, bop, bee-wop, bop, bop. It's because that's what they were doing. They knew that eventually they needed to bop on their muscles. Back in the 50s. And you can swear if you want while you're doing this if it hurts. You can say motherfucker, whatever you need to say to get it out. Because you know that you need to get this out because you've got to get through your day. It's 5 a.m. and you're like thinking to yourself, I've only got 5 hours of sleep. But at least I know that I'm taking care of what I need to take care of to get through my day. Oh yeah. Okay. So let's see. What else needs to be worked on? The glutes need to be worked on, as usual. Okay. We'll just make this one big old honking video. Put that under there like that. And roll on those glutes. The glutes are best worked with a leather softball. I actually put the link to a leather softball on Amazon on my site. There you go. Just click on that. And you can go get you one of these sent to your door, or you can go over to your sporting goods shop and buy a leather, not a plastic, softball. And it really is such a great tool. It's required. One more required massage tool. Okay, so search all over. Like there, it's more towards the bottom And there it's more towards the bottom outside, the bottom left. And you want to get it right on the spot. And if you're trying to film, you may have to keep it right like where people can see. And it's not so easy, but I'm so... Okay, so it looks like it ran out of film. It ran out of film like it's running tape. It ran out of film, and I hope you saw how I was working on those glutes diligently with the soft ball. And that's it. That's pretty much it. And I want to wish you a happy, rockin', excellent 2016. And much good work on your bod, on your intestines, on your mind, everything. I just looked at myself in the mirror and man, I look so damn good this morning. But my hip is going to be feeling so much better. My low back on my left side, that's going to be feeling so much better because now I've released all of those tight bands of muscle that are connected to each other. I probably should work on my feet too, using the foot friend. Okay, so this foot friend kicks freaking ass. And I'll just show you briefly. That's how it works. And these outer muscles are going to be connected down here to these muscles here. This fascia along here connects around the heel and then goes up the side of the leg. So I just happen to be able to feel how on that outside there, it's tight. So if you've got foot pain, it may also be because these are tight. In my case, that's not as much the case. But still, I can feel that that's partially the problem. Because the outside of my foot is tight. Okay, and then I'll get the soother tool out and work on these here. But anyways, thanks for joining me. Have a great 2016, everybody. Bye-bye. Okay, so we're going to play with this dog toy. Do you want to play with a toy? He wants to get it. Get him! So this is what we do every night. I'm either laying in there, throwing it in here, or vice versa. Come! Can I have it? You want to get him? She's so special. Get him! Retrieve him to Dad. Bring him in here. Come on. Jackrat. Can I have it? You want to get him? Now watch. She likes to play this thing like she's getting it in the hole. You know how dogs like to get creatures in the hole? Get him! Now watch. It's so funny.
Okay, do you want to get him? Get him!